My name's Denton. I'm a sexual health nurse and I work at the Department of Genitourinary Medicine at Nobles Hospital.
Hi, I'm Amanda Dawson and I'm the lead nurse for Integrated Sexual Health Services for Manx Care. So STI stands for a sexually transmitted infection. So anybody who is having sex with another person can potentially acquire a sexually transmitted infection. What we advise is once a person becomes sexually active, we would encourage people to come in and get themselves regularly checked up. So it depends on how many sexual partners you have. So we say to some people it would be a good idea to get a checkup after a new sexual partner, but for some people that might mean very frequent visits to the clinic, and for others it might mean, you know, a checkup every 2 years. So it's a matter of people looking at their own risks, seeing whether they've got any symptoms. If they've got no symptoms, just come in for a checkup. If you have lots of sexual partners, which is fine, just get yourself regularly checked up to make sure that you're okay.
We see about 3,000 people per year, so that works out about 250 attendances per month. And we see quite a range of ages, mostly between, I would say, sort of the 16 to 40 age group, but we see people under 16 as well, and quite a few people over 40, so it varies a lot, but mostly within that bracket. The most common bacterial STI that we see is chlamydia, and the reason that's so common is because the majority of people with it have no idea they have it, so that's why it's more important to get a checkup, whether you feel there's anything wrong or not, because it can be a silent infection.
I think they do. I think a lot of people are scared of coming for a checkup. We would say it's nothing to be scared about. We do our utmost to try and take the stigma away from sexual health services. It is part of your health. You wouldn't have all these feelings if you were going to see your chiropodist or your dentist. It's part of your health and we feel very passionately about it. It's an important part of your health that you need to look after, and it's very easy to look after it. You know, coming along for a checkup is not difficult anymore now. We've changed our testing. You don't even need to be examined in a lot of the cases. It would just be a case of doing a simple urine test or a self-taken swab. So a lot of people are scared of the whole process. They've never maybe been to the doctors on their own or anything. So I think there's some friendly faces here. We welcome people, and most people who come tell us it's not as bad as they feared. So I think we do our utmost to make people feel welcome and try and take that stigma away. I think we see a mixture of both. We see a lot of people that come in for routine testing, and we certainly encourage that. We get a lot of people who are in new relationships and they both come in for a checkup, which is a fantastic idea. And then we also have people who've been in contact with infections, and either they'll be contacted by a previous sexual partner or we'll contact them to invite them in for a checkup. So it's a mixture of both. We're happy to see everybody that needs our service.
Okay, so if you want to come and see us at our clinic, you just need to give us a call on 650 710. You can call us directly. You don't need to be referred. You don't need to see your GP first. We make the appointment if you give us a call, and we'd be happy to see you. The process when you come to clinic is we ask everyone to fill in a registration form when they arrive, and that's just some details. Mostly we want to know your mobile number so that we can get results back to people, and that's usually how we do that. The process is then you wait in the waiting room, hopefully not very long. You're seen by a nurse or a doctor who just asks you a few questions about your general health and your sexual activity, just so that we know what tests to do for you and that we're doing them at the right time. You're offered a range of tests depending on what you've told us. Routine checkup is very simple these days, as I think we've already said. You can do a urine sample or a swab. We offer people blood tests as well, which is routine, but it's important to know that we offer you whatever testing we think is necessary, but it's up to you to accept, or you can have as much or as little done as you want. You come to see us and we try and do what you'd like us to do for you. Regarding the results, usually what we do is we send a text message. It's an anonymous message. It just says, results all clear, or give us a ring on this number. So it's very discreet, so if anyone can see your phone, they don't know that you've been to the gum clinic at all. Young people are a lot more clued up now about these things, and actually if the word gets out there that actually testing is very simple and painless, in fact for most boys, men, it's a urine sample, and actually I think that's what maybe historically used to put men off, because they didn't quite know what we were going to do to them, or they heard stories about horrible things that we do. But that's not the case now, and it's really straightforward. It's just